Now let's get into the types of surgery for abdominal aortic aneurysms. And one option is to remove the damaged areas or the parts, as opposed to maybe having everything removed.
That's correct. So no, So we would try to repair more than remove in the traditional way.
Okay, so first repair.
In other words, the aneurysm itself, although we do it sometimes when the aorta is infected, most of the times, when we are dealing with a simple aneurysm, we just try to cover it. In other words, we would try to divert the blood from going into this big sac into going into this graft, this prosthetic tube that we insert inside the patient's blood vessel. That way, the blood would be still coming to the periphery. It would be going where it needs to go, but it would not enter this sac. And therefore, this sac would start to depressurize, and hopefully, what we'd like to see eventually shrink.
Right. But now, what is the likelihood, Dr. Tsoukas, that that same sac can later on become another bulge?
So even when we repair aneurysms, we can have problems such as we call them endoleaks, where blood can escape, just like we discussed. The neck of the aorta is not always a perfect circle. There are areas of calcification, irregularities, angles, and so forth. So blood can escape around this area of contact between the graft and the aortic neck and still come inside the aneurysm. There are also some side branches that the aneurysm sac can have and can bring blood retrograde. This rendition actually doesn't show any of the side branches, again, in an oversimplification, but branches can bring blood and maintain the aneurysm sac still flowing, still open. So there are different types of what we call endoleaks after a repair like that.
Absolutely, this have to be watched.
That can bring a little bit of complexity in what we call post-operative care, how we care for the patient after the procedure is done.